Good afternoon, my name is Tina Gote Santiago, and I am completing my final presentation for PAD 3820, Public Safety Systems Integration, with Dr. Richard Warch. The title of my paper is Integrated Proposed Public Policy Plan for Emergency Management for Mass Care Plan. My certification statement is here and it's signed. My table of contents, this is what we'll be going over. And let's begin with the introduction. Emergency management programs are developed to ensure public safety in times of crisis where panic, fear, and confusion can cause chaos, and leaders are expected to respond with strategic action plans to help support the people of their community. A comprehensive emergency plan acts as a guide to respond and to mitigate losses by coordinating and synchronizing efforts of all government and key stakeholders with pooled resources during all phases of emergency management. It is designed to meet the needs of the community in a methodical way with efficient all-hazard responses and threats as an established framework with instructions with clear sets of roles, responsibilities, actions that can be taken throughout an incident and ensure that everyone is cared for. For the purpose of this paper, the student will identify key elements of a proposed public policy plan of an integrated mass emergency care plan. Again, to shape all hazard integration responses to effectively address this plan. In the City of Oklahoma, Office of Emergency Management, a comprehensive emergency management program, utilizes FEMA-approved hazard mitigation plans included in their coordinating public and private initiatives capabilities. This allows them to prepare, protect, mitigate responses, and recovery across all phases of the incident, identifies in the National Preparedness Goals that are on the next page, is to secure a resilient nation with capabilities and requires across the whole community to prevent, protect against, and mitigate response to and recover from threats and hazards that pose the greatest risk. These risks include natural or man-made, pandemic-related emergency support functions, and just to name a few. An integrated response plan is organized with several different levels. The Secretary of the United States Health and Human Services Act, Section 301, identifies public health issues that are monitored and affected populations and acts in the development of mass care emergency assistance by the Department of Health and Human Services in preparation and planning processes. This is shared throughout the paper. There are integrated jurisdictions on how they work together in coordination of these efforts. As the first line of defense, the state, local, and tribunal authorities respond to events that support of the whole community as a pandemic emerges, and Mass Care Agency coordinates the primary responsibilities and identifies and responds with adequate resources. In the event that the resources do not meet the needs to care for this incident, FEMA, the Federal Emergency Management Agency, under the Stafford Act, is authorized under the Presidential Declaration of State of Emergency or Disasters in order to help them coordinate provisional life-sustaining mass care and emergency assistance support. So what this means is that there are additional resources that are prepared to step in and give this support. So the purpose of having a comprehensive preparedness guide is to make sure that we have all information needed to support emergency managers in decision making. in order for them to efficiently manage the life throughout the lifestyle with communication and overlapping resources, there has to be a way to streamline this information. So through public safety, NIMS, National Incident Management Systems, it helps to organize this data and it's all collected in one place. Under policy setting, they assist in decision making with a high level oversight. They help to set priorities. They guide all levels of government and non-government organizations that are working together to protect against the mass disaster. The central operating system is actually where they coordinate all of this, these efforts for all hazard responses and capabilities. Effective and efficient management of personnel and resources are required throughout the incident in order to get people the help that they need when they need it. Through the interagency communication, the Incident Command Center actually works with the Public Information Officer, the Safety Officer, Liaison, Operations Planning, Administration, and Logistics. So they all are working together in one system with a uniform language. So everyone knows what they're responsible for as things arise. In addition to support communities, when there's non-emergency related things going on, they are promoting outreach programs to help improve and support community resilience with awareness. Sometimes they'll give out brochures, they'll update web pages, they'll provide information available on social media. All of this to enhance preparedness and with education and promote safe practices and preparation. The development of action plans to respond to potential hazards, all of this to minimize unnecessary loss of life and property when incidents occur. In order to develop a strategic management plan in context during a pandemic, it is important. It's so important to consider a great deal of that goes into this planning process. So the HHS and the CDC work together to support agencies to ensure the safety and efficiency delivery of services. So when we think about the mass medical needs during a pandemic, they would have to consider where would they shelter people? How would they feed the people that they have to shelter while they're caring for them? How do you, in a pandemic, separate people can be contaminated in order to prevent a potential virus from spreading? How do you help those under your care who have other underlying conditions that may need medication for? All of this information goes into creating this strategic plan. An integrated public safety emergency response. During a state of emergency, the federal state statute authorizes the HHS to take action to prevent the spread of communicable diseases domestically and afar. Many jurisdictions do not have the capability to manage a disaster of this magnitude. The critical infrastructure needed, as I described earlier, for the operational success cannot be executed successfully without established, predetermined strategic planning to appropriately care for the mass population during outbreaks. Mass care practitioners that can help to identify ways to ensure the vital support is made available to meet the public's needs in the times of crisis. With federal guidance and interagency support, public health officials can identify, monitor, prevent, and control pandemic illness and the spread of it when an incident happens, when they're able to coordinate efforts. Public policy information in modern government, public policies in society are the laws that are enacted by government entities that make decisions to allocate financial and physical resources to support the communities during in an effort to meet the needs of the greater good. So historical events and public response help to shape policies made by the elected officials. In times of crisis, such as public health emergencies or in a pandemic or outbreak, people want to feel safe. They depend on the government to take critical action in times of need, to fulfill their oaths, and keep communities safe from these threats. A pandemic threat that is beyond the means of a local agency jurisdiction will naturally refer to the larger agencies to support the communities to meet those needs and resources. Emergency management planning and federal financial support is not enough to explain all of the complexities associated with a pandemic would need in order to ensure the resources are made available. Therefore, it is important that it gets planned in from the beginning, the strategic planning processes, creating an emergency management infrastructure that is uniform and in action that can support the needs of various jurisdictions. So the interagency communication and networking and support supported by FEMA and NIMS and the CDC and so on at HHS, they all are working together in one strategic management form in order to meet the needs of the country or the communities impacted by the disaster. So this concludes my presentation. These are my references here, and I will submit this later today. Thank you. Have a great day.